A hearty good afternoon and welcome to our session on the topic of myths and facts of pregnancy. To educate us on the topic, we have Dr. Shilpa Apte among us today. And Dr. Apte is a consultant for Obstetrics and Gynecology at Apollo Cradle and Children's Hospital. And she will be addressing most of these issues to help relieve you of any stress or paranoia among pregnancy. Doctor, you have the stage.
Sure. Thank you so much. Yeah. Good afternoon, everybody, and a warm welcome to another session of Facebook Live by Apollo Cradle. I'm Dr. Shilpa Apte. I'm consultant obstetrician and gynecologist with Kurmangla Cradle, as well as I also consult with Janaga Cradle. So today we are going to touch upon a very interesting topic: myths and facts of pregnancy. Now, most of the time we see that whenever any woman gets pregnant, she will have so many doubts and queries in her mind, and out of that, unfortunately, quite a few are wrong. Uh, but then, so many times it does happen that the family members, sometimes relatives, so many times it's also your maid servant who will have certain opinions about the pregnancy, about what food should be consumed, and so on and so forth. So it's always better to get these doubts clarified instead of just relying on whatever that is hearsay. So we will touch upon quite a few of the myths which are commonly felt or commonly discussed amongst pregnant women. So we will go, step by step. Few of the myths which are related to your, the food in pregnancy. The most common or the first myth which I will touch upon is that pregnant women usually ask me, should I now start eating double of what I'm eating currently? So not at all, So pregnancy is a physiological condition wherein, gradually the requirement of food increases, and it's not that as soon as you come to know that you're pregnant, you should start eating double of what you have been eating. The most important aspect of the diet should be your nutritional value of what you are eating. So ensure that it is, a balanced meal wherein there is some portion of carbohydrates, little bit of fat, proteins, and also calcium-rich foods like milk, curds, buttermilk, and so on and so forth. So the amount of calorie intake that should increase in pregnancy is just about 300 calories more than what you normally consume. So it's not that you should eat double, definitely not, because rather that will increase your weight unnecessarily and put you at a higher risk of having high blood pressure, diabetes, and pregnancy. The second most common myth, or rather the most common question which people ask me is it not fine to have a glass of wine if there is a party at home or something like that? So, definitely, absolutely not. No alcohol should be consumed in pregnancy, even if it is a glass of wine. The glass of wine might be having certain other health benefits for people who are not pregnant, maybe also in a in a small quantity, but definitely not in pregnancy. Any kind of alcohol should not be consumed in pregnancy. The same thing applies for smoking, of course, but luckily nobody asked that question, and most of the people are aware that nicotine is absolutely a no-no in pregnancy. The third most common question asked is, or the myth is, that you should not have any coffee or tea in pregnancy. Now, that is not really true. Even if too much of caffeine is not recommended in pregnancy, maybe up to 2 to 3 cups of tea or coffee is absolutely fine if you are having it throughout your 9 months. So that's it's not that you should totally stop it. But yes, it's a choice. If some people feel that they would want to go off the caffeine, any type of caffeinated products, that is also it's fine with us. But it's not that mandatory that it is going to harm the pregnancy. So if you want to continue, you can definitely continue at least maybe up to 2 or 3 cups in a day. Along with that, of course, you need to ensure that you have milk at least 2 glasses. Now, again, this is a very common question wherein patients tell me that, okay, fine, in the milk I'll add a cup of, or rather a spoon of coffee, and isn't that fine? So, no, not at all. You need to have your milk separately, and maybe you can have a cup or two or up to 3 cups of coffee or tea, whatever that you like. The next common myth is about seafood. Now, a lot of times patients want to know, should they go off seafood as soon as they are pregnant? Not at all. There are so many people who are, quite comfortable or who have always been eating seafood even before they have gotten pregnant. So they can continue to do so. The only advice that we give patients is that avoid trying out any new seafood. Like people who have never had or never tried, prawns or something like that, or crab for that matter, and and then suddenly if they want to try this type of seafood during pregnancy, it can happen that the body is not used to it, and you can develop an allergic reaction, which can be sometimes severe. So it's always better to continue to have seafood that you've always eaten, fish that you've always eaten. Again, in fish, yes, there are a few fishes which we want patients to reduce their intake. Fishes which are rich in mercury. Now, fish like tuna is definitely rich in mercury, and especially the canned tuna. So it's always recommended to avoid tuna as much as possible. But say once in a while, say through the pregnancy, if you're having just once or twice, that should not really cause much harm. But avoid fishes which are loaded in mercury. But otherwise, generally, if you are used to having fishes which you've always consumed, I don't think that should be a major concern at all. As far as India is concerned, I mean, here locally people regularly, of course, ask whether papaya can be consumed in pregnancy. It is a known fact that yes, raw papaya is known to cause miscarriages in some patients. There have been studies which have been conducted. So as a rule, we ask patients, yes, you can. It's better to avoid papaya. At the same time, people do ask whether pineapple can be consumed. Definitely, there is no risk with pineapple. There are no studies to say that pineapple should not be consumed. But then maybe you can just avoid papaya. Pineapple should not be an issue, really. Apart from that, most common myth is about travel. As in, people there are a class of patients who feel that it's absolutely fine, they can travel whenever they want, wherever they want. And there are a class of patients who want to absolutely avoid traveling, or rather they are stuck in their house, or even if they have to go to their office, they are like, oh my god, I don't want to go. Now that is not entirely true. See, it's a case by case decision that your obstetrician will take. If you're having some complications associated with your pregnancy, then definitely there are occasions wherein we ask you to go on complete bed rest, sometimes no travel, absolutely. And there are occasions, there are some patients who are quite healthy, and when they ask us, if there is, especially if there is some emergency in the family and they really need to travel, we allow them with certain restrictions. The most favorable or the best time to travel would be the middle trimester, that is between once you've completed the first trimester and before you start with your third trimester. So between the fourth, fifth, and sixth month is the safest time to travel. Again, it all depends on whether it is a domestic travel or an international travel. I always advise my patients that it's always better to avoid planning a travel in pregnancy, because we would not know what are the challenges that you can sometimes face with respect to whether the flight is getting delayed, or whether the place that you're going to travel to, whether the food there is going to be food that you like, or you will be able to consume or not. Because finally, for us, the most important aspect is the nutritional aspect of your meal, so that should not get compromised. So all these things also need to be kept in mind, not just the travel part. But yes, if you are going to travel and if you really need to travel internationally, then yes, you need to remember, usually international travel is around, say, starting from 5 6 hours. It can extend up to 24 hours if somebody is traveling to the US. So in this kind of a scenario, it's always better to keep yourself, for pregnant women especially, to keep yourself hydrated. Ensure that you have at least, keep on sipping on water. Try to avoid any caffeinated products like cola, soft drinks, and all. Maybe a cup or two of coffee is okay, but continue to have clear liquids, like you can have buttermilk or tender coconut, and best is to have plain water. Keep yourself mobile, that is every 1 hour try to move around in the cabin, so that the risk of, see, any woman who is pregnant, and if she is going to be sitting in the flight for 7 8 hours, more than that, there is always an increased risk of having or developing clots in your feet. So in order to reduce that risk, it's always better to keep yourself mobile in pregnancy, and then try to keep yourself hydrated as much as possible. Yes, if it is not an emergency, better not to plan travel. But then if you have to go, then yes, these are the few precautions that you need to take, and try to travel in the middle trimester. Of course, you also need to keep in mind the COVID scenario of that particular country. If the COVID situation is fine, then yes, you can maybe think of traveling. If it is still, that there are a few more cases than what you're currently that we are seeing in India, there are very less cases, and if you are traveling to a country wherein there are more cases, it's better to avoid. So it's a very individual situation which we need to look into and then decide whether travel is permitted or not. There are some patients who have, conditions wherein yes, the placenta is a little low lying, which can increase the chances of having bleeding in pregnancy, which can be again risky. So if that's what I'm saying, so it's always better to consult your obstetrician and find out whether it is fine for you to travel, and only then take a decision. It cannot be an all or none phenomenon for everybody. Yeah. Apart from that, yes, the common again myth is that morning sickness. When we call it morning sickness, most of the patients feel that the vomiting should happen only in the morning. And if they are getting sickness, or if they are feeling sick or having vomiting in the evening, it is not related to pregnancy. Again, it is a very it's a very common misconception. The reason why the term morning sickness was coined was because usually there is a the rise in the hormone which basically triggers the vomiting in pregnancy is much higher in the morning, and that's the reason, say, out of 10 women, maybe 6 7 women were experiencing sickness in the morning more, and that's the reason the term got coined. But doesn't mean that you will not get sickness in the afternoon or late in the evening, or even it can be any time of the day. Now, whether a woman or how bad a woman gets vomiting in pregnancy is determined by so many factors. It can be, one is most important is your genetic factor, as in if your mother has had very bad vomiting in pregnancy, the chances are that you will also have vomiting in your pregnancy. Most of the times, yes, the vomiting is, it peaks around the seventh week. So it is more majorly seen in the first trimester, very rarely seen that it continues in the second and the third trimester. So the period of pregnancy will also determine whether you're going to have vomiting or not. Sometimes it's the food items. So there are people who tell me that generally they are very comfortable with, say, egg or even other non-veg food items. But as soon as that they have gotten pregnant, that they are not able to, tolerate the smell, or they are feeling pukish, or they are vomiting when they are, seeing the such food items or trying to eat those food items. So it's a very individual thing how the body reacts. During pregnancy is absolutely different from person to person. So you are the best judge. You need to see as to when the vomiting is more, and after what particular food items the vomiting is more. You also need to keep a track that in order to reduce the vomiting in pregnancy, try to have small meals through the day. So if you're having some meal, every 10 minutes, or every, say, at least some dry item, try to have small meals through the day. So continue to have your three major meals, that is your breakfast, lunch, and dinner. And in between, try to have maybe some light snack. So that will help in reducing the acidity, which in turn induces the vomiting in pregnancy. So these are the few things which you can take care of, and then you can definitely bring the vomiting under control. But definitely, it is not just morning; it can be sickness any time of the day. Another very common question which people ask me is, should I sleep on a particular side? Now, many times it's all asked as soon as the patient is pregnant, that should I start sleeping on say left side, or most probably it is asked whether I should sleep on the left side. Now, it is a known fact that yes, as the pregnancy advances, sleeping on a particular side should not matter really. Finally, we are looking at the comfort of the patient. Finally, we are looking at the fact that you should sleep, or you should get enough rest, at least 7 to 8 hours through the night. And that is the most important thing for us. Whether you're sleeping on left side, right side, whether you're sleeping on your back, doesn't matter really. But there are some patients who are very anxious because they have heard some stories, or they have been given any opinion from their, say, mothers or grandmothers, or somebody saying that, oh my god, don't sleep on one side, because if you're going to sleep on one side, the loop of cord of the baby will get wound around the neck. Now that is a very it's a very common myth which is expressed, but definitely should be, you should remove that fear from your mind. Sleep comfortably, sleep peacefully, sleep for at least 7 to 8 hours in the night, and try to relax in the afternoon if it is possible, at least for 30 minutes. So that is the advice that we give. Yes, we do feel, or rather, it is a known fact that as the pregnancy advances and when you are approaching your due date, the growing uterus can put some pressure on the the major vein, which goes behind the inferior vena cava, and that sometimes just lead to people getting scared that, oh my god, is it going to reduce the flow of blood through the, or the flow from the limbs towards the heart. But there are studies to say that there is not much of a difference, and you can continue to sleep in whichever position that you are comfortable. Even if it is, say, on the back, it's absolutely fine for us, so long as you are sleeping at least 6 to 7 hours through the night. Okay, another common myth is that your shape of your belly will tell us whether you're going to have a baby boy or a baby girl. There is nothing farther from the truth. The fact remains that anybody who is pregnant for the first time, since the muscles, the abdominal muscles are quite taut, so the shape is fairly similar to most of the patients, irrespective of whether it's a boy or a girl, of course. There is no scientific data to say that yes, and it is obviously, there cannot be any data to say that yes, this is what is going to happen. Usually, when women get pregnant the second or the third time, the muscles would have lost their tone, and that's why the shape will appear in a particular fashion. So that is the only scientific explanations to say. But then, if it has resulted in a situation wherein, say, somebody has had a baby girl the first time and the second time, because the tone of the muscles had gone, and then she delivers a baby boy, she will assume that yes, because my so this was the shape, and that is has resulted in me getting a baby boy. It's absolutely wrong. So never assume that the shape of the belly will determine. There is also one more common myth which my patients have asked me, saying that yes, when they go for their Dopplers or when they go for their scans, and if the heartbeat is a particular value, so if it is more than 160 or so, they assume that it is going to be a baby girl, and if it is around 120 or so, they assume that it's going to be a baby boy. Again, it is an absolutely wrong situation. There are occasions when if the mother has had a meal, say half an hour back, or if she has had a little, she has climbed say a flight of stairs or something like that, so obviously her heartbeat increases, and in turn the baby's heartbeat will also increase. So it is not at all related to the gender. No connection between the gender and the heart rate of the baby. Then yes, another very common myth which people have, or they assume that as soon as they get pregnant they will have a very nice and glowy skin. Rather, I will say that most of the times, because of the increased progesterone hormone levels in pregnancy, people get a very bad breakout of acne, or they can even have sometimes what we call as melasma and floesma. That is, they will have a butterfly-shaped kind of stains, or rather, it is kind of darkening of the skin. Most of the patients will have some darkening on the nape of the neck. They will have some darkening on the in the front of the neck also. So just assuming that once you get pregnant you will have a glowing skin is actually far from the truth. But there are some lucky patients, yes, who don't have much of changes in their skin, and that is when they feel that maybe they are glowing because of the pregnancy. But it's again a very very common myth, and you should just remove that from your head that I should have been glowing, but my skin is a little dark, but it should not have been. And then another very common myth is that if you apply cocoa butter, I don't know from where this has come, but most of the patients have logged on to so many websites, and then they find that there is a cream called as cocoa butter, and if they apply, then there will be no stretch marks. Now that is a very common, again a misconception. See, any kind of moisturizing will help in keeping the skin moisturized, but how much stretch marks you are going to get will also be determined based on again the genetic factor. Whether your mother has had very bad stretch marks, there's a very high chance that even you will have bad stretch marks. But at the same time, yes, if it is a second or the third pregnancy, the number of stretch marks can be a little more, or it can be the same that you had during your first pregnancy. But moisturizing, yes, it will help in reducing your the irritation of the skin if you are getting some breakouts because of that on the abdominal skin. So that will help. But say a particular cream or a particular moisturizer will help in you not getting any stretch marks is far from the truth. You can continue to moisturize so that you don't get much of scratchy feeling or itchiness on the, because the skin is getting stretched over a period of time from the fifth month onwards. The whole idea of why we recommend moisturizing to most of our patients is so that, because as they advance from the fifth month onwards, there will be more of stretch on the skin, which can in turn lead to itchiness over the skin. Also, because of the hormonal changes of pregnancy, there are some patients who do experience dryness of the skin, which again is a vicious cycle. So they, because of the dryness, they feel like scratching, and that rather leads to more of marks there on the abdominal wall. So just continue to moisturize. So that will help in reducing the irritation or the itching that you're feeling on during the later months of pregnancy. But assuming that yes, if I apply this particular cream or this particular moisturizer, I will not get any stretch marks at all, is definitely far from the truth. Uh, Yes, apart from that, yes, there are some patients who do ask me whether they can dyeing of their hair. Now, see, we will not say that dyeing will harm the baby, not at all. But then we will also ask our patients whether they have dyed their hair before. Now, there are occasions wherein, they want to die the first time in pregnancy, and that is when we don't recommend. Because any dye, usually if you are going to dye your hair, they ask you to do a test to see whether you're allergic, whether your skin is going to be allergic to it. And more so, especially in pregnancy, you will be at a higher risk because the skin is more vascular. And if you try the dye without doing the proper, if you have never tried the dyeing before, and if you try it in pregnancy, it can happen that you suddenly develop an allergic reaction. But directly per se, it is not going to harm the growing baby. So if you are used to dyeing before, you can continue to do so without much of a fear. Another very common myth is that you should not exercise, or rather, like I said, there are a group of patients who feel that you should not exercise at all. You should, while walking or sitting, also you should be very careful. And there is a group of patients who feel that no, you can do any kind of vigorous exercise. So it's always better to take a middle path. And again, it's an individual case basis. Speak with your obstetrician, find out whether exercise is allowed in your pregnancy. Like I said, there are some occasions wherein if the placenta is low lying and you are at a high risk of getting vaginal bleeding, it's always better to avoid exercise till we are very comfortable with the fact that the placenta is no longer in the lower segment and it would not lead to any gush of bleeding or something like that. So always consult your obstetrician first and find out whether any exercise is allowed. And if the exercise is allowed, what kind of exercise? We usually recommend that yes, you can continue doing your half an hours of walk. Try to do pregnancy yoga. Again, it is specifically pregnancy yoga exercises. Don't continue to do whatever yoga exercises that you were doing before you got pregnant, because those excessive stretching and again certain positions which can sometimes make you fall should not result. Same thing applies for, there are patients who ask me whether I can continue to walk on the treadmill. It's fine to walk on the treadmill so long as you are comfortable, so long as you're not getting any giddiness, so long as you are sure that you are not going to trip when you are walking on the treadmill. So the whole idea is that ensure that you are doing with your routine activities, but without harming yourself, without falling or getting an injury, which can in turn harm the baby. So directly exercise per se is not going to harm your baby. Rather, it's always recommended that you continue to do some kind of exercise to keep yourself mobile. So that is how it should be treated. And always ensure that you talk to your obstetrician before you embark on any kind of exercise. There are patients who, or there are people who are very comfortable even swimming, but then again, it's a very individual thing. If your blood pressure is fine, there is no risk of you developing any giddiness when you're in the water, it should be okay. But then if there are certain restrictions, then always speak with your obstetrician before you embark on it. Another very common myth is when a person is planning for the childbirth. Most of the times, people feel or they assume that natural birth is the best way. If they even get an iota of an idea that, oh my god, it might be a cesarean in advance, they start really worrying about it. That if it is not a natural birth, it is not going to be normal. That's not the case. Again, like I said, for other few situations, it's an individual case basis. Most of the times, if you are not having any medical complications, like there is no high blood pressure, your sugars are within normal limits, your placenta is not low lying, the weight of the baby is in the average range, and if you are also, your pelvic bones are spacey enough to allow the baby to deliver, I think natural birth should be definitely tried. But assuming that natural birth is the best, and if you land up in a cesarean, that something is wrong with you, or it's definitely not, that the patients start feeling very disappointed that they landed up in a cesarean. I think that attitude should be removed from your mind. It should always be remembered that childbirth can be either natural or it can be an operative childbirth, that is through the cesarean. And accordingly, you should be mentally prepared, because there are so many occasions wherein patients are they ask us, we have been fine, or I have been fine through my 9 months of pregnancy, and now at the last moment when I have gone into labor, I have landed in a section. There are so many situations wherein the baby would have the baby's heartbeat, baby would have pooped inside, you would have heard from so many of your friends. And that is the reason that we have to operate such patients and deliver the baby as early as possible. There are so many occasions wherein we really wait for a few hours for the patient to progress, but how much ever that we have waited, even if we have waited for 10, 12 hours, there's no progress at all. And that is when again that particular patient lands up in a cesarean delivery, even if she has had no other complications. So it can be either complications which would have developed before you went in labor, or there are certain complications which develop during labor, which can land you up in a cesarean delivery. But I don't think you need to really get worked up about it, or rather, assume that, oh my God, since it's a cesarean, that it's something bad which has happened with me. It should have been a natural birth. Yes, of course, we always recommend that we should always try our level best for a natural birth. But if it doesn't happen, I think we should be okay with, if it's an operative delivery as well. There are a few other small myths which are there. That if you eat spicy food, it can induce labor pain. If you eat a certain type of food item, then it can induce labor pain. These are again myths only. There are few patients who ask us that if they have intercourse during pregnancy, is it going to harm the baby? No, not at all, because the baby is within its own cocoon. It is inside the womb, and there is also the amniotic fluid which is surrounding the baby, and the membranes which are covering. So ideally, yes, intercourse will not harm the baby. But again, there are certain occasions wherein we do ask patients to avoid intercourse. But if you're comfortable and if there is no other complication with the pregnancy, then I think intercourse can be quite safe, and it is definitely not going to harm the baby. So that myth also should be busted from your mind. I think I've covered most of the myths. I'll just check if anything is pending from my side. Yeah, there is. Yeah, there are many again important point which I would want to cover is about pet cats. A lot of times, patients when they come to us and if they're having a pet cat, and once they get pregnant, they're like, "Oh my God, I have heard stories from my friends and relatives that now that I'm pregnant, that what should I do? I have a cat." Now, it's not that you have to just because you're pregnant that you have to leave your cat away, but yes, if you are pregnant, you need to be very particular in not handling the poop of the cat, because there is a particular type of infection called as toxoplasmosis which gets transmitted if you're handling the poop of the cat. So the most important thing to remember is, even if you have a pet cat, you can continue to pet your cat or continue to enjoy the parenting of your pet cat, but don't handle the poop. Give that work to somebody else, and say, assume if the pet is in your backyard garden or somewhere, and wherein she is used to pooping, she or he is used to pooping, then ensure that even that area gets cleaned up as soon as the cat has pooped. So these are the few things which you should keep in mind as far as the pet cat is concerned. But otherwise, I think continue to stay and enjoy your parenting with your pet cat should not be stopped. I think I've covered most of the myths, and if anybody has any questions, you can go ahead with that. Most of the myths I think have been covered, and I've tried to clarify. Yes, very common. The most common, which is I would want to end with that. The most common within, especially in our Indian culture, is whether saffron, which is mixed in the milk, and if you consume milk from the third or the fourth month, whether it will make my baby fair. Now, obviously, it's a given that finally the color of the baby is determined based on the genes that the baby is going to inherit from both the baby's parents. So whatever is the color of your parents, you will get the same color. The saffron, what it will do is, yes, if you want to continue or if you want to start having saffron mixed in the milk from the third or the fourth month, it will help you in rather sleep well. It helps in stabilizing the mood swings which happen during pregnancy. So if you want, you can definitely mix it in the milk and start having from the fourth month. But hoping or assuming that it is going to give you a particular result with respect to the color of the skin of the baby, I think we need to bust that out. That is not going to determine the color of the skin of the baby. So I think most of the myths we have covered and tried to clarify most of your whatever myths that we have come across over so many years of my practice, and also so many myths which I have heard from my few of my relatives, my friends, and all. So if any questions are there, you can go ahead. Right. In the comments. Right. Okay. Is it okay to have sesame seeds? Yeah. I think somebody has asked me the question that whether they can have sesame seeds that is still. Yeah, absolutely fine. There is no problem with sesame seeds. You can have. Yeah. Yeah, if any other questions are there, I would definitely want to cover. Should we wait or one question has come? We already answered that. Yeah, here I think here also it is showing the same thing. Do I need to answer here or okay?
Doctor, there are no more questions in the chat, and
Okay,
I guess we can end the webinar in this case.
sure. Okay then. Thank you so much. Yeah. Okay.
Thank you, everyone.
Yeah.